we're going to talk about forensics today. There's going to be a lot of stuff that you're going to be learning in your lab manual. We're going to be going over how to tell the sex of an individual based on the skull and the pelvis. We'll also talk about age determination, looking at epiphyses and dental eruption, also some sutures. And then we'll finish with the fun stuff, which is kind of the pathology and cause of death. So we're going to look here at a couple of skulls. You can see male versus female skull features on pages 186 and 187 of your book, but there are some main ones here. First is overall size. You can definitely see that the male tends to be overall much larger than the female. Now, of course, there's going to be a lot of variation in our species, but overall, we do have slight sexual dimorphism favoring larger, more muscular males than females. Now, one thing that you're really going to notice is the shape of basically the forehead and the brow. You can see there's some projections here on the male skull. On the female skull, it's very kind of more smooth and rounded, so you don't have that projection over the eyes of the brow ridge. So that is one determining factor. Another factor is going to be the shape of the chin. You can see on the female skull, it is very kind of gracile, it's very slender, it's kind of in a nice U shape. On the male, you can see it's very kind of blocky and squared off. It's also thicker and more deep set. Another thing we're going to look at is going to be the mastoid process. This is this little part here that juts down right under your ear here. And this is a muscle attachment. So you can see that it is kind of small and not very rigid, because remember, we're looking at the roughness of bone to see how much muscle attachment is there. In the male, you can see it is much larger and it is very, very rough and ragged. That shows a lot of muscle attachment. Same for back here, the nuchal area. This is where your neck muscles would attach, and you can see a lot of roughness. So a lot of muscle attaching here. You're just not going to see quite as much roughness on the female skull. Again, these are overgeneralizations, but they do tend to show patterns in males versus females. All right, next we're going to look at the pelvis. The pelvis is going to be covered on pages 187 and 188. Starting off, of course, you can see that there is an overall larger, rougher appearance in the male pelvis versus the female pelvis. Again, this is probably the #1 place to look for determination of sex in a body, because females have adaptations for childbirth that men just don't need to have. So when we're looking at the female pelvis, when you look at the female kind of the birth canal or the opening here, you can see that it is very kind of open and wide. There's nothing really getting in the way here, right? Because obviously you're going to need to pass a baby through there. When you look at the male inlet, it is very triangular. Okay, it's very triangular, and it just definitely, you can still see the coccyx is there. You can see a lot of the bones would kind of be in the way, and this just does not look like a good pelvis to pass a baby through. When you're looking at the pubic bone, the subpubic angle on males tends to be less than 90 degrees. It's very kind of narrow. For females, you should tend to see a much wider angle, and this is going to open even more during childbirth. So the overall idea is that in female pelvis, you're going to see things much more open and wide. In males, you're going to see it more narrow. We also have the sciatic notch here. This is what helps pull the sacrum and coccyx away, pull it back to leave that birth canal free and open. So you're going to see a very wide sciatic notch here. On males, you're going to see a very narrow sciatic notch. That coccyx is right in the way because nothing needs to pass through there, right? So the male pelvis tends to be much more kind of rigid and compact, and the female pelvis tends to be much more open and wide. Speaking of that, you do have a little bit of information on the pubic symphyses. This is on pages 194 and 195. You have them illustrated. It's not a huge thing that you need to know, but the pubic symphysis does get a lot of wear and tear just from us being bipedal and walking around. but childbirth is really going to put a lot of trauma on this. So you can see nice, rough, clear ridges on a very young person. As they continue to age, you can start to see it get very, very smooth and worn down. So this can also help us to determine the age of someone based on the wear and tear of their body. Now, the other thing we're looking at in forensics is going to be age determination. The first thing we want to look at is going to be the epiphyses. These are the growth plates in humans. When we're born, we have a ton of different bones in our bodies than we have when we're adults because they fuse together over time. Children, babies, toddlers, they're super flexible, right? Because their growth plates are actually all cartilage. They're really bendy. Once you start to grow, you feel those growing pains. That's everything kind of growing, building, and then fusing together. Once you get into your late teens, early 20s, all your bones are kind of finishing fusing. Your last bone to fuse is your medial clavicle right here around age 28. That means old age or degenerative changes, the wear and tear on your body start around age 30, which is super fun, right? So here we have a juvenile femur, and you can see there's actually more than just one bone here. We have the growth plates are not connected because this is how they look. Everything in between would be cartilage. It would be very flexible. Up here as well, we have the top. We have the head of the femur here. It is a separate bone. If we saw these remains, we would know this person is a very young individual because this is not a broken bone. This is a growth plate that has not fused yet. So you have a nice chart in your book, and we'll practice this. If they are completely unfused, they are going to be at the lowest age on that chart. If they are completely fused, they are going to be at least the oldest age on the chart. And if they're somewhere in between, then they're somewhere in between. Okay, so this would be the lower age range because this person has not yet finished growing. Same thing for teeth. Dentition, you can look at pages 191 and 193. This skull has cut away so we can actually see how the teeth are growing in. You can see that there are some adult teeth pushing the baby teeth out. Some adult teeth are just starting to grow in. Some have fully erupted. So you can use the chart to help figure out, okay, what age range would have this mixture of adult and deciduous or baby teeth in their mouth. We can also look at old age, right? By the time we get to grandpa here, he's lost all of his teeth. And that's because, you know, we put a lot of wear and tear on our teeth, even with modern dentistry. So if you see a skull with a lot of wear and tear or a lot of missing teeth, that usually denotes an older age. Same thing for sutures. If you're looking at a young person and you're looking at the sutures, you can see all those squiggly lines. You can see them very easily. This is because the skull is actually also in pieces while we are developing, and it fuses together as we are very, very young. Once you reach an advanced age, though, the sutures are harder to see. They sometimes, you can see over here, they sometimes are just kind of not even there. You can barely see them. And that's because mitosis is changing over the cells constantly. You're getting new refresh cells, and that's going to make the squiggly lines get less and less and less and less over time. So you can look at sutures as well. If they're hard to see, that's an older age. If they're very clear, that's a younger age. Last thing is just kind of more for fun. You have a little bit of pathology, but I also do like a nice extra credit. So I like to go through some of these skulls and just kind of show you some of the pathology. So for example, here we have a gunshot wound. You can see that there is an entrance hole at the front, and this is the entrance hole at the back here. It's very smooth. This is the beveled exit hole where you can see it's very rough and jagged. What we want to focus on in forensics is the role of healing. This bone is completely rough and jagged. That means it has not healed at all. This would be the cause of death for this person. Now, however, on assignment, if I asked you, did this person die from the gunshot wound? You can't say, yep, because it went through his brain. Guess what? There's a lot of people who've actually survived. This skull was also shot. It was a very bad injury, but do we see how smooth the bone is? This person did not die from this wound. As crazy as that looks, this bone is smooth. It is repaired. So this person did not die. So you can't just say, yep, it went through the brain, they must be dead. You have to use actual forensic technology. All right, here we have a syphilis patient. Okay, this is what's called popcorning of the skull. This is a nasty bacterial infection that will actually eat through the brain and start to eat through the cranium. Once it gets to this stage, it is fatal because it has actually destroyed the brain underneath. So this is a venereal disease, but once it gets to this stage and travels all the way up into the brain, it is fatal. Here we have a couple examples of blunt force trauma. So when you hit somebody with an object, and you can actually kind of see the indentation of the object, which can help us to determine the murder weapon. In this case, this was a hammer. Now, it's kind of unclear whether this person died, and the way I say this is you can still see the imprint, okay? Sometimes when you have a blunt force trauma, you'll see concentric circles or radiating fractures. This person does have a little bit of smoothness. You can still see the original fracture. So this would be, you're not going to be able to determine if this was the cause of death, because maybe they got hit with a hammer and they were in a coma for 3 months. So they did have some healing, but then they ended up dying. But they also could have had some healing and left the hospital and gotten hit by a car and died. So this would not be able to be determined. Same here, even though that looks really bad, everything has smoothed out, so there is evidence of healing here. Okay, we do not see fresh wounds, so this could not be 100% cause of death in this person. The last two are disease pathology. I just wanted to show you, it's very interesting. Here we have a severe vitamin deficiency, and it's called cribia orbitalia. Under here in the eye orbits, you can see there's lots of little tiny holes, and that is because of this vitamin deficiency. So this is something that we find a lot of times in archaeological sites. We're looking at, medieval, or as I do with ancient Egypt, and we can see dietary issues. We can see that people may have died from malnutrition or vitamin deficiency. And here we have leishmaniasis, which is a disease that you get from the bite of a sandfly, and it starts to attack the bones in the face. So you can see how this person's jaw was just obliterated. It can actually eat away the person's nose, and it can, of course, be fatal, but you can see all of the horrible disfigurement that you see all in this person's, basically their mouth and their sinus area. So this would be the cause of death for this person.